Hello everyone, and welcome to our channel. Today, we're diving into the intriguing world of experimental designs in behavioral science. We'll explore different types of designs like the multiple baseline, alternating treatments, and multiple probe designs, among others. Understanding these designs is crucial for anyone involved in behavior analysis, as they help us determine the effectiveness of various interventions. Whether you're a student, a researcher, or just curious about how these designs work, this video will provide you with a clear and concise overview. So grab your notebook, and let's get started on this educational journey together. The Multielement Design, also known as the alternating treatments design, is a method used in behavior analysis to compare the effectiveness of two or more interventions or treatments. Here's an easy explanation, along with examples to help you understand this concept. Basic concept of multielement design. This design tests multiple treatments by alternating them rapidly during the study. This way, it measures how each treatment affects the same target behavior. Think of it like switching between two different teaching methods to see which one helps students learn better. On different days or sessions, you might use method A, then method B, then back to A, and so forth. Roles of data points in multielement design. Prediction. Each data point under a specific treatment helps predict how the behavior will respond under the same conditions in the future. Verification. It checks if the predicted behavior under a treatment actually happens. Replication. It provides a chance to see if the treatment consistently produces the same effect each time it's applied. Demonstrating experimental control. First, no overlap effective control is shown when the data paths results from two treatments don't overlap much, meaning one treatment consistently leads to different outcomes than the other. Second, distance between paths. The bigger the gap between the results of two treatments, the clearer it is that they have different effects. Variations of multielement design. Single phase alternates conditions without a distinct baseline or follow-up phase. Two-phase starts with a baseline to measure behavior without intervention, followed by a phase where treatments are alternated. Three-phase best treatment, after the alternating phase, continues with the treatment that worked best. Three-phase participant's choice allows the participant to choose which treatment to continue after trying each. Concurrent chains design. Different treatments are available simultaneously, and the subject chooses between them. Advantages. First, no withdrawal needed. Unlike some designs, you don't have to stop a treatment to see if it's working. Quick comparison rapidly shows which treatment works better. Flexible, effective even with unstable data or when behaviors don't revert easily. Generalization can check if the effects of treatments apply in different situations or continue over time. Limitations and appropriateness. Treatment interference. Because treatments are alternated quickly, they might influence each other's effects. Isolating one treatment after alternating them helps clarify its individual impact. Artificial setup. Rapid switching may not reflect typical clinical or educational settings, which might make this design seem unrealistic. Limit on conditions. Usually, you can only effectively manage up to 4 different treatments in one study. Need significant differences. Works best when the treatments are clearly distinct from each other. Not for slow-acting treatments. If a treatment needs to be applied continuously to work, this design won't be suitable. Examples. Imagine a school testing 2 different methods for teaching math to students. Method A uses visual aids, while Method B uses interactive activities. By alternating these methods across several lessons and closely monitoring students' test scores, educators can determine which method leads to better performance, adjusting teaching strategies accordingly. Let's practice with mock exams. Mock Exam 1. A researcher is studying the effects of two different teaching methods on student engagement without establishing a baseline. The methods are alternated in each class session over a semester. Which multielement design does this scenario best describe? 1. Single-phase design. 2. Two-phase design. 3. Three-phase design best treatment. 4. Concurrent chains design. Correct answer is 1. Single-phase design. This design is characterized by directly alternating treatments without a separate baseline or follow-up phase. In this scenario, two teaching methods are alternated throughout the semester without establishing a baseline, fitting the description of a single-phase design perfectly. Mock Exam 2. A clinical psychologist begins a study by observing a patient's stress levels without any intervention for 2 weeks, before introducing and alternating two different relaxation techniques. Which multielement design is being used in this scenario? 1. Single-phase design. 2. Two-phase design. 3. Three-phase design participant's choice. 4. Concurrent chains design. Correct answer is 2. Two-phase design. The two-phase design involves an initial baseline phase followed by a treatment phase. In this scenario, the psychologist observes stress levels for 2 weeks, baseline before introducing treatment's intervention phase, which aligns with the two-phase design approach. Mock Exam 3. After testing 3 different behavioral interventions in a school setting, the teacher decides to continue using only the strategy that led to the most significant improvement in student behavior. What type of multielement design does this scenario illustrate? 1. Two-phase design. 2. Three-phase design best treatment. 3. Three-phase design participant's choice. 4. Concurrent chains design. Correct answer 2. Three-phase design best treatment. This design involves an initial phase could be baseline or alternating treatments, followed by a phase of alternating treatments, and a final phase where the most effective treatment is continued. The scenario describes testing and then continuing with the best performing intervention, matching the three-phase design focusing on the best treatment. Mock Exam 4. In a therapy setting, after trying several treatments, a therapist allows the patient to choose which therapy they felt most comfortable with to continue for the remainder of the sessions. Which multielement design does this scenario represent? 1. Single-phase design. 2. Three-phase design best treatment. 3. Three-phase design participant's choice. 4. Concurrent chains design. Correct answer is 3. Three-phase design participant's choice. This design variant involves trying multiple treatments and then allowing the participant to choose which one to continue. This perfectly matches the scenario where the therapist lets the patient choose their preferred therapy. Mock Exam 4. In a study to determine food preference, different food items are presented simultaneously to children, who then select which one they prefer to eat. What multielement design does this scenario best fit? 1. Two-phase design. 2. Three-phase design best treatment. 3. Three-phase design participants' choice. 4. Concurrent chains design. Correct answer is 4. Concurrent chains design. This design is used when subjects are presented with simultaneous choices, and they select their preference. In the scenario, children are presented with different foods at the same time and choose their preferred item, aligning with the concurrent chains design. Mock Exam 6. A behavior analyst wants to assess the effectiveness of two behavioral interventions for reducing outbursts in children with autism. Each child receives both interventions alternately during the study period. Which experimental design is being used here? 1. Multiple baseline design. 2. Alternating treatments design. 3. Multiple probe design. 4. Delayed multiple baseline design. Correct answer is 2. Alternating treatments design. This design is used when two or more interventions are alternated to compare their effects directly. Each child receives both interventions in an alternating sequence, allowing for immediate comparison. 1 and 3. These designs are not used for direct comparisons of two treatments in a simultaneous, alternating fashion. 4. This design is for staggered introduction of the intervention, not alternating treatments. Mock Exam 7. A researcher starts a study to compare the effects of 3 different therapies on patients' anxiety levels. The therapies are introduced in sequential phases to the same group of patients. What kind of design is most likely being used? 1. Single-phase multielement design. 2. Three-phase multielement design. 3. Multiple baseline design across behaviors. 4. Non-concurrent multiple baseline design. Correct answer is 2. Three-phase multielement design. This design involves a baseline phase, an intervention phase where treatments are compared, and a follow-up phase. It's suitable for sequential phases applied to the same group. 1. Single phase does not involve sequential introduction across phases. 3 and 4. These do not involve the sequential comparison of multiple treatments on the same group. Mock Exam 8. A school psychologist is studying how well different classroom settings affect the concentration of students with ADHD. The psychologist observes one behavior across different classrooms. Which multiple baseline design is being utilized? 1. Across behaviors. 2. Across settings. 3. Across subjects. 4. Delayed multiple baseline design. Correct answer is 2. Across settings. Observing one behavior across different classrooms indicates a multiple baseline design across different settings. 1 and 3. Focus on behaviors or subjects, not settings. 4. Delayed start is not indicated. Mock Exam 9. In a study examining the effect of a new teaching method on reading comprehension, each session alternates between the new method and the standard curriculum without establishing a baseline. This scenario describes which design? 1. Multiple probe design. 2. Single-phase multielement design. 3. Two-phase multielement design. 4. Alternating treatments design. Correct answer is 2. Single-phase multielement design. Alternating between two methods without a separate baseline phase aligns with a single-phase design. 1 and 3 involve more complex structures not indicated here. 4 typically involves more structured phases. Mock exam 10. A therapist introduces a communication intervention to 3 different subjects at different times to ensure independent evaluation of the intervention's effects. Which design does this describe? 1. Multiple baseline design across subjects. 2. Non-concurrent multiple baseline design. 3. Concurrent chains design. 4. Multiple probe design. Correct answer is 2. Non-concurrent multiple baseline design. Introducing interventions at different times to different subjects without simultaneous data collection describes a non-concurrent multiple baseline design. 1. Typically involves simultaneous data collection. 3 and 4 are not relevant to staggered introduction. Mock exam 11. A clinician is investigating 2 therapeutic interventions to determine which is more effective at reducing symptoms of depression. The treatments are administered alternatively over several weeks, with ongoing assessment. Which design is being applied? 1. Alternating treatments design. 2. Multiple baseline design across behaviors. 3. Multiple probe design. 4. Delayed multiple baseline design. Correct answer is 1. Alternating treatments design. Alternating between 2 treatments for comparison fits the alternating treatments design, allowing for direct evaluation of each. 2, 3, and 4. These designs do not involve alternating treatments in the described manner. Mock exam 12. To evaluate the effect of behavioral interventions on self-regulation skills. A researcher takes intermittent baseline measurements before introducing any treatments. What design does this scenario most likely represent? 1. Multiple baseline design. 2. Multiple probe design. 3. Delayed multiple baseline design. 4. Non-concurrent multiple baseline design. Correct answer is 2. Multiple probe design. Taking intermittent measurements aligns with the multiple probe design, which is used when continuous measurement is impractical. Mock exam 13. In a study to improve organizational skills, a single subject is observed under baseline conditions, followed by the introduction of an organizational tool. And then the process is repeated with an enhanced version of the tool. This experimental setup is an example of what kind of design? 1. AB reversal design. 2. Alternating treatments design. 3. Two-phase multielement design. 4. BAB design. Correct answer is 1. ABAB reversal design. Repeating the introduction of an intervention after a return to baseline suggests an ABAB design. 2 and 4. These designs do not typically involve repeated cycles with the same intervention. 3. Involves different elements, not applicable here. Mock exam 14. To determine which of 2 math teaching methods is more effective, a teacher alternates between method A and method B daily, measuring student performance. What design is illustrated in this scenario? 1. Concurrent chains design. 2. Alternating treatments design. 3. Multiple baseline design across settings. 4. Multiple probe design. Correct answer is 2. Alternating treatments design. Alternating between two methods daily for direct comparison perfectly describes the alternating treatments design. Mock Exam 15. A research project involves several autistic children, each receiving a different behavioral intervention at varying starting points throughout the year to manage disruptive behaviors. This setup is best described by which design? 1. Multiple baseline design across subjects. 2. Delayed multiple baseline design. 3. Non-concurrent multiple baseline design. 4. Alternating treatments design. Correct answer is 3. Non-concurrent multiple baseline design. Introducing interventions at different times throughout the year without simultaneous data collection matches. The non-concurrent multiple baseline design 1 and 2 involve more synchronous or delayed but overlapping data collection, not applicable here. 4. Does not fit the structure of introducing interventions non-concurrently. Thank you so much for watching our video on experimental designs in behavior analysis. We hope you found it informative and that it helps you understand how these designs can be applied in real-world scenarios. If you enjoyed this video and learned something new, please give us a thumbs up and subscribe to our channel for more insightful content. Don't forget to hit the bell icon to get notifications for our upcoming videos. If you have any questions or topics you'd like us to cover in future videos, please leave a comment below. We appreciate your support and look forward to seeing you in the next video. Until then, keep learning and exploring.